Thank you very much. Thanks, Claire. I really appreciate that. So hopefully I'm just going to share this and then hopefully that should work for everybody. I can't see everyone now. So if you do have something to say then please do just call out or whichever, or use the chat. I'm sure hopefully Claire will be able to pick up anything that's in the chat. So in terms of my aims today, I just wanted to provide an overview of the different components that are required for a whole school approach. So as part of my training, I am required to complete a thesis, and my thesis looks at how whole school programs are evaluated and how we can implement them in schools to get maximum impact, basically. So prior to becoming a trainee educational psychologist, I was a primary school teacher for 4 years in a school in Sefton, and I was Senko as well during that time. So you become very aware of the impact and importance of mental health and well-being in schools. So that was one of the things that kind of was a motivational factor for me to look at this area, just an awareness of the number of programs that are out there, and also how difficult it is to identify whether they're working or not, and what barriers there are to implementing them. So I want to provide some practical ideas as well of what it might look like in school, think about how we evaluate it, like how we know if it's working, and especially when there's such big programs with many different aspects, and then just talk about some of the key barriers. So my research looked at one whole school approach called emotionally friendly schools, which Salford Educational Psychology Service created and have rolled out. I think there are schools in Salford, Wigan, and Greater Manchester as well that are implementing that programme. So it thinks about the barriers to that programme, but those barriers can be applied to kind of any whole school approach, really. Yeah, so just a little bit of background, really. So the research does suggest that whole school approaches are best practice for mental health provision. They are what's recommended sort of by Public Health England, by the DfE. But when we evaluate, do these programs work, it's a bit mixed. We find that they do have an impact, but maybe the effect size is smaller than we would expect, because it's one of those things where all the components should make sense and should work, and then we kind of evaluate it and we're like, oh, that was a bit underwhelming. We thought it would come out with a bigger impact than that. One of the key reasons is to do with implementation. So implementation talks about how well is a program implemented within a setting, how well does it meet what was intended to be implemented. So quite often you might have a program that when it's implemented in a really controlled way, in perhaps a trial school where there's a lot of monitoring and support for implementation, that it works really well, and then everyone rolls it out and we say, yeah, this is brilliant, this worked great. And then you look at how it's working in schools where there's everyday life occurs, and maybe it's not been implemented with quite the same level of control over things, maybe things have gone a bit wrong and it's not having the same impact. So there's a bit of a difference between on paper implementation, how things should go, and real life. So that's a key consideration. So it's really helpful then to think about, well, how can we implement them the best that we can? What factors are important when we're implementing them? Because we know that if it's not put into place to its full ability, if it's not implemented as best as it can be, then the effect of the programme, the impact on the program. So therefore, it is really important to think about how we best can do that. That was a little bit of background really about why we were looking at this. So Public Health England produced a model of whole school mental health approaches. So that is the model that's on your screen now. It's within a report. That report is actually really helpful and breaks down each of these areas in more detail. I've put the reference in the notes, which you'll get when you get the slides. So Yeah, so basically at the centre is obviously leadership and management, and then it talks about different components, different principles that need to be in place when putting in place a whole school program. So I think that that was kind of the first thing that I wanted to talk through today, was how as a school or a college setting we can use the research from these areas to affect our practice. What can we actually do? What can this whole school program look like? And it might be that it's a whole school program that's been bought into, like the Emotionally Friendly Schools program, for example. I know that there are quite a few other ones out there. I think Thrive, Nurture Schools as well has a similar approach. Or it might be something that you, as a senior leadership team, or a researcher working with a school, creates this sort of from the ground up and might use this as a bit of a model of what it needs to look like. So a whole school program, therefore, would need to include elements across the whole school. It's not about putting one intervention with one group. It's about making changes on multiple levels within the school from, the very top. And that's why ethos and environment, which is in the top left semicircle there, um, is so key to that, as well as leadership and management, because it starts sort of from the top. So these were kind of highlighted by Public Health England as the key areas. So I'll talk about each of these in turn now. So leadership and management, why is that important? So a whole school approach requires big changes and big investment to make those changes. It's not going to be something that you can do sort of make small decisions, small changes. It has to be on a much bigger scale than that. The head teacher has to be on board with this, and I'll come back to this when I talk about the barriers, because that was something that was highlighted. If you don't have the head teacher on board, then it can be really difficult to get the time, the money, the focus to make those changes. And it's also vital to have a shared vision, so everyone being on the same page, and that often comes from leadership. So what might this look like within a school? It might include a mental health and wellbeing team of staff, which includes members of leadership or or the head teacher. One of the barriers that I'll talk about later was programs seem to be implemented better where there is a team implementing it, and a team that actually works together in reality and not just a team on paper. What sometimes can happen is that there is a team of people responsible, but one person is ultimately responsible because perhaps it's part of their goals for the year or whichever. It worked best when there was a team that each had different skills to bring to it and that included leadership, because if you've not got leadership on your team, then it was very difficult to get anything through, basically. It might look like including this as a focus on perhaps a school improvement plan or a progress plan. Thinking about a designated role within SLT. I think we now have, more and more focus on this and thinking about, okay, does the person that's responsible for this need to be within SLT to be able to make those changes, or how can I work closely with SLT in order to make those changes? By SLT there, I mean senior leadership team. Changes made to plans and policies and the ethos of the school. One thing that comes up quite frequently is that a school might have one side or one area, perhaps a pastoral team, working towards this, and then having another area where different decisions are being made. Quite often things like behaviour policies, for example, can work directly against some of the things that we're trying to achieve through a whole school mental health and wellbeing approach. So it's making sure that everyone's on the same page and has that shared vision to be able to put this in place, and that is going to involve making changes to plans, policies and things like that. Involvement of the school governors. Are the governors aware of what the plan is? Is this a priority in this school? And thinking about capacity, these types of programs are big. They require time, they require money, and they require focus. If they don't have that time, money, and focus invested, they don't work. That's basically what the research suggests. So that's one of the reasons why leadership and management is so key. So ethos and environment, how a school feels when you walk through the door. Is it somewhere that children and staff, want to be? They spend a huge amount of their time there. Is there research has suggested that when we focus on well-being within schools, within the ethos, it increases the connectedness, and increased feelings of connectedness means less conflict, fewer disruptive behaviors, smoother transitions, and better expression of emotions. So we can see why those things are important and why it makes for a better sort of feeling within that. What it might look like, again, change into policies, change into behaviour policies, anti-bullying policies, physical changes to the school environment. I worked with a school where they had built an outdoor sort of therapeutic area for children to spend time with. Where I've worked in schools where they've worked really hard to make, for example, maybe a therapeutic space within the school where priorities have changed, and a room that had previously been prioritised for learning intervention now is been prioritised perhaps as a family room. And it's a juggle and it's a balance, because schools constantly need space, but it's about thinking, okay, if we don't get the emotional well-being right, children aren't going to be in the right space to learn, so maybe this needs to be a priority. So using ambassadors, staff and pupils can be helpful, and having familiar routines and safe spaces. So all those things within the ethos and the environment can contribute to increased connectedness, and then we can see the benefits of that. We can see why a bit of investment in the ethos and the environment is going to be beneficial for us long term. Curriculum, teaching and learning. So proactively teaching social and emotional skills acts as a protective factor. So where we actively teach these skills, it can prevent the development of mental health difficulties and risky behaviours. And that in turn increases school attainment and attendance. Where this has been taught, it can lead to less involvement with the criminal justice system. And interestingly enough, staff social and emotional skills are linked with staff wellbeing and effectiveness. So it's kind of a double-edged, I've forgotten the phrase, but it's basically, it works for both staff and pupils. So what might this look like? One school that I worked with had developed a social and emotional mental health curriculum that was important. They'd looked at the things that were important for their children. What were the key issues that children in their setting were facing, and what patterns were they noticing? And then they built this sort of curriculum where children accessed. I think it was on a fortnightly basis. And that included adaptation of existing resources. So the PSHE Association and Healthy Schools, they have curriculums that you can look at. But I think it's about prioritising that and thinking, no, we need to explicitly teach these skills because we know that has a knock-on impact. Explicit teaching of coping strategies, so mindfulness and breathing techniques, physical activity and art. And not being a one-off. I think sometimes we can have, we're going to have a well-being day, and we're going to have a mental health week. Well, that's fantastic and it's brilliant because it raises awareness, but what are we doing every other day of the week, and how are we incorporating these skills into our curriculum and explicitly teaching them? Because I think sometimes what happens is we don't explicitly teach them and children don't pick them up. Not all children pick them up, or they don't have the models perhaps at home to model these skills, or lots of different reasons, they don't develop those skills. So it's about how are we actively preventing this from happening in the first place. Interestingly enough, giving students a voice, and this can go from nursery age right up to college age. What do children like? What are their views on things? They need to feel that they've got an influence and a voice, and they need to feel heard. And I think we can link that to our own experiences, that if you've ever been in a meeting where you can't get a word in edgeways and you're just desperate to contribute, and you think, oh, I don't feel heard, I don't feel listened to, and how that makes us feel, it's important to consider, are there young people in our settings that have that sort of feeling? So obviously school councils and ambassadors, have been within schools for a long time, but are they able to make real changes? Is it that, you know, they're kind of told what to do, or is it more that we are listening to them and getting feedback? And also thinking, are we getting the feedback of all children? There might be a certain type of child that is more likely to be involved with the school council or be an ambassador or volunteer themselves. What about those children that perhaps aren't attended at the moment because of mental health needs? Or what about children who are very, very quiet that we don't hear from, or children that are very, very disruptive? And so perhaps we don't think to kind of consult with them on some of these things. Sometimes just asking them why can be a key breakthrough, and we find out more information about what has led to that. Maybe consider the development of a pupil wellbeing team who look at development in this area. And yeah, so like I said, avoid just listening to the voices of the most motivated and able. Consider how the views of children and young people who are struggling can be valued as well. Maybe think about a survey. And we at Sefton, over the lockdown, we did a survey of over 1,200 children about their experiences of lockdown, and it gave us a huge insight. And you're not going to get, you are going to get some silly answers. You are going to get some children who say, I want McDonald's every day at break time or whatever. But you are also going to get interesting insight into how they work. And I think sometimes surveys can be a really good way of doing that. So we use an online survey format because it's a little bit more detached, and they might feel that they're a bit more anonymous. Yeah, and consider co-production as well. Are children involved in the development of policies? Are they involved in the development of training that you deliver to staff? If you're delivering training about mental health, for example, to staff, are you asking the children within your setting who are experiencing mental health difficulties what they want their teachers to know? So thinking about how children can be involved with that in a number of different ways. Staff development and wellbeing is absolutely key, and I don't know how many people listening are working in schools at the minute. I think for many schools, wellbeing is an absolute all-time low in terms of the amount of pressure and stress, and so many pulled in so many different directions that school staff have been in over the past year, and dealing with their own circumstances, plus trying to deliver things in schools for key worker children, plus delivering things at home, plus constant government changes. It's been incredibly difficult for many people, and well-being starts with the staff. If you are extremely stressed, and if you've got staff that are extremely stressed, well-being is very, very poor, that will have an influence on your ethos, your environment, your staff, how they're feeling coming in, and children can feel that. 62% of teachers, and this was before the pandemic, report experiencing stress and anxiety, and 77% of senior leaders. So I think that it's almost accepted within education, well, it's going to be a stressful job. Having been a teacher and left and doing something else now, there are lots of jobs out there where that level of stress is just not acceptable and wouldn't be accepted. So I think we need to think really, really carefully about how we can affect change in that area. Because as well, teacher well-being and student well-being and academic outcomes are all interconnected. So where your teacher well-being is poor, student well-being is poor, and academic outcomes are impacted. And again, teacher stress and burnout has been linked with negative outcomes for pupils. So if you've got a head sort of or saying, well, we need to be prioritising the pupils here. Yeah, well, okay, even if we're going through the focus of prioritising the pupils, to do the best for the pupils, we need to have the best for the staff as well, because actually the research found that those things are linked. So what can we do? make meaningful changes. Things that are tokenistic need to be avoided. I don't know whether anyone else has been in this experience, but when I was a teacher, we were required to attend a mindfulness session once a week for a period of time. That was not great for my well-being because I had so many different things to do, and no one had asked us as staff what we wanted. So there's that thing about voice asking what is wanted and making it meaningful. What would have made the biggest difference would be to change the marking policy, because that was why I had so much marking and could not engage with the mindfulness at that time, because I was so worried about my marking. Once the marking policy changed, we were much more able to then engage in the things that are good for well-being. I'm thinking about flexible working, use of planning schemes. Ask staff what's important to them. Maybe completing a staff audit as well can be useful, and having a open view to that, what comes back, because sometimes it can be not what we're after. Provide training opportunities to develop skills, and consider the use of supervision for staff development. So I've linked in the notes for this slide a link to a blog produced. It's called the EdSci blog, which is for educational psychologists, but it's actually really interesting for all researchers and sort of school staff. And it's about how we can use supervision as opposed to more maybe punitive or judgmental approaches to staff development. Because I think when we've got a world where observations and book scrutinies are normal and every day, it can affect the culture within the setting. And I think that supervision can be a really good way to help staff development without trying to add further pressure to how staff are feeling. So I definitely recommend having a little read of that blog. It's really interesting. Identify need and monitoring impact. So early identification can prevent mental health and wellbeing difficulties from escalating, reducing the need for more significant intervention in the future, which is better for the child, and it also saves us money if we're going through that lens. Mental health needs are increasing, so 1 in 6 children aged 5 to 16 meet the criteria of having a mental health difficulty, and schools will play a key role in identification and support. So just being aware of appropriate assessments if you've got a concern. So I've made a couple of suggestions there, but thinking, okay, if we had a child where we were concerned about this, how would we know, how would we measure, things like that. And also using more informal measures on a regular basis, things like emotional thermometers, check-ins, emojis on the wall, in the playground, having it surrounding you all the time. Methods for staff to chat about concerns regarding mental health and wellbeing with a designated staff member, and logs of any mental health and wellbeing concerns. I think this might be the last one of these. So working with parents and carers. So families play a key role in influencing children's emotional health and wellbeing. That's a key finding. And universal and targeted interventions that support parents and families are hugely beneficial. So they've found to have a big impact. So think about, what do we offer for parents? Things like workshops and training opportunities on emotional wellbeing, on mental health. Drop-ins for concerned parents can be helpful. Working with local charities or employing a family support worker to provide support services for families. Asking parents and carers what would be helpful for them. And giving an opportunity for parents or carers to express concerns about their children's wellbeing, like something like a screener at the start of year 7, for example, to highlight any concerns at that point. So where children are needing further support, we need to think about targeted groups. So some children are more likely to experience mental health difficulties. For example, children who are care experienced, who've experienced trauma, young carers, domestic violence, special educational needs. So having a clear graduated response to emotional mental health difficulties, including signposting, onward referral and the use of specialist services. Implementing interventions and resources such as wellbeing toolkits, counselling support, 5 ways to wellbeing plan, which I've put on the next slide, I think. And using key staff in schools such as key workers, pastoral support, relationships being so important there. It might be helpful to put together an individual support plan focusing on emotional, mental health and wellbeing. Okay, so I haven't put in the 5 ways to wellbeing. I've obviously forgotten to do that, but basically, it's I can add it in. I'll email it over to Claire. It's something that if you follow me on Twitter, I shared it on Twitter, and it says the 5 ways to wellbeing. So all of the 5 different ways of wellbeing, and it's basically using that as an action plan. Thinking about what can we do, what are we already doing in each of those 5 ways to wellbeing, and what could we do. So it's just a nice way of having a targeted plan to look at different interventions and things like that. But yeah, I'll put my Twitter handle in the chat at the end, but I will make sure I add it in before I send the slide, so sorry about that. So those things that we've kind of covered would be the basis of what a whole school program needs to have to be effective, those different areas. The other thing that we need to think about is, how do we know if it's working? A key issue with whole school approaches, they're so big, there's so many elements, all those different things that I've just talked about in some ways need evaluating, because how do we know if it's working if we're not evaluating each of those things, if we're not evaluating the impact on parents and carers, if we're not evaluating the impact on staff wellbeing? What do we measure and what tools do we use? So I did a review of the existing literature on this, and basically there's hardly any research about how this should be evaluated. Lots of people using different approaches. So I'm sure many of us will remember SEAL, which was a key social and emotional learning program that was rolled out across schools. There was a few evaluations of that, and again, across different evaluations, different tools were used. And one of the key things was that, what are we measuring? Are we measuring whether children's academic ability improves? Are we measuring whether children's mental health symptoms decrease? Are we measuring positive mental health? Are we measuring number of behaviours, exclusions, attendance? There's so many different things that you can measure in that. So yeah, so I've put there, in case anyone's interested, it is now published, how exciting. I've put that in a link to the full review of how whole school mental health programs have been evaluated in the notes of this slide. But basically the key findings were that most evaluations are only measuring impact on the child, which on the surface we think exactly that's what we want, because we want it to have an impact on the child. But as the diagram previously showed, there are so many different areas these programs might be having an impact. So changes to school ethos, changes to staff wellbeing, and yes, eventually those things will lead to impact on the child. But first, we need to see whether it's having an impact in those areas themselves. So yeah, that was one of the key things, was if you've got this big program that you're trying to make changes across a number of areas, are you evaluating all those areas? Do you know if each of those areas is working? Questionnaires were used so often. They were the most frequent way of sort of doing a pre and a post, doing something before and doing something after. And when we were looking at the impact on children, they're evaluating 4 areas. So internalizing symptoms, feelings of anxiety, depression, mental health need in general. Behavioural adjustment, which meant things like children's behaviour in the classroom, attention, challenging behaviours, aggression. Social emotional adjustment, so peer relationships, peer difficulties, ability to problem solve, emotional literacy, ability to recognise your own emotions as well, and school performance, so test results essentially. One thing that stood out was that very few people evaluated positive impact. So very few people looked at whether, for example, children's resilience improved. Very few people looked at whether children were happier, which seems almost the opposite of what you would think, because that is our aim. We want children to be happier and healthier, but a lot of the time we were focused on more of a deficit approach. So whether children were unhappy, whether children were experiencing depression, whether children were experiencing anxiety, and less about the more positive psychology side of things. And the other thing to note is that evaluation was often done on children. So by that, children's levels of, for example, depression or anxiety were measured, but they weren't consulted within that. No one really asked children how they were experiencing the program. No one asked them if it was making them feel happier. They filled out a questionnaire. So that was something that was really interesting, especially when the role of children's voice and how empowering that is something that's included within the literature, but when we're evaluating it, we're not really including them within the research. Okay, so it's really fast paced. So I'm sorry if if I'm jumping a little bit. I just wanted to pack in as much as I possibly could, and hopefully it's useful. So this final part just looks at the facilitators and barriers that were found within my research, looking specifically at the emotionally friendly settings, it's called, program. It's changed partway through my research, so that's why I'm mixing the name up a little bit, because I think they're doing nurseries as well now, so that's why it's so a program can be the perfect program, and research can have found a huge impact on well-being, but if it's not implemented properly in a school, then it's not going to work. I can think of lots of things that, for example, when I was a teacher, we were asked to implement, and life happens and it doesn't happen as you would plan, but you can't then expect to have the same impact afterwards. So I asked schools who were implementing this program to complete a questionnaire. We had, I think, about 43 schools completed this questionnaire about the impact in their schools. And then from that, I interviewed 2 schools that were reporting high impact, 2 schools that were reporting medium impact, and 1 school that was reporting no impact. The reason that there was only 1 school reporting no impact is because only 1 school reported no impact. So they were the only one we could interview. There was 2 secondaries, 2 primaries, and 1 secondary pupil referral unit. And we used semi-structured interviews to talk about what made a difference to them. So the reason that I'm sharing this today is hopefully knowing some of these barriers can help us proactively avoid and try and prevent these barriers from stopping the program being implemented. So these were the findings. The biggest thing, which I think anyone who's worked within education will be able to recognise, is that where implementation was authentic and meaningful, the program worked, and where it was tokenistic, it didn't work. Which sounds like pointing out the obvious, but actually within the research, there's very little conversation about this, about is the implementation of the program just on a tokenistic level. And yeah, I'm going to talk briefly through these themes. Again, this paper has been submitted for publication, so we'll see if this one gets accepted. But if anyone was wanting to read the full paper, I'd be more than happy to share that. So tokenistic talks about surface level implementation. And what I found was that this tended to happen where it was motivated by something extrinsic, so maybe achieving accreditation. Some schools talked about the Blue Peter badge. There's the situation where you have programs being implemented to meet a criteria, or because Ofsted have told us to, or because the local school improvement team has told us to, and less because it's something that we really need for our school. And in these schools, quite often, this idea of being emotionally friendly was seen as a fixed thing. They'd already achieved it. They already were emotionally friendly, and so they did not need to kind of make any further changes. They just wanted to have that noticed and valued and ticked off that they were doing that. Where it was more authentic, it was very well embedded, it was meaningful, and it had been motivated by sort of intrinsic factors within those implementing it. So maybe a desire to develop practice, or sometimes when there was a real clear need within a setting. And I spoke to some people who talked about, well, we just knew this was what our setting needed. So a key thing, which I'll come to later, is why it's being implemented. So I found this really interesting. So you can jump through hoops and you can tick all of the boxes and come up with all of the policies and tell the people at AFS, oh, here's our evidence. But the reality is, when they've gone away, that's not what's really going on. So is it meaningful? Because sometimes these programs are being evaluated, it's coming up as, oh, it's not really having an impact, but maybe it was just being implemented at surface level. A key thing that contributed to that was the role of leadership. So I've mentioned this already once before, but it really is key. It only seemed to work in schools where leadership were really invested in it, because it was very difficult to make changes where someone didn't have the authority or status to implement them. One of the participants was PSHE lead and had been given this to do, but actually had very little way of trying to make the changes that needed to be made, because they weren't on SLT. They were struggling to, pin down their head teacher to meet with them, just because the head was so busy, and it wasn't a huge priority. So they'd kind of been given it as a project to get on with, like, oh, you can implement this program, we'll get the accreditation. But in reality, it was much bigger than that. One thing that was really interesting was that actually a couple of participants talked about how the core values of the head teacher could be a key factor. So how the head teacher viewed wellbeing and the value that they placed on it. So where it was kind of seen as, oh, it's not something, we need to particularly worry about, it was much harder to implement, which kind of makes a lot of sense, but it also kind of shows how important it is that that person or that group of people, if it's a team, a leadership team, are kind of on having that shared vision. So they talked about, you've got to have senior staff leading on it, or it's just never going to change. Attitude to the program was a key factor as well, in terms of why had people joined the program, why was this being implemented? And if you are implementing a whole school approach, you need to think, why are we implementing this? Are we implementing it because we want to tick a box, because we need to show that we're doing something, or do we really believe in this, and do we really believe that actually this is what our pupils need? Who's made that decision? I had one school who had already implemented one approach, and a school improvement service had said, well, we think you should do this one instead. And they'd kind of gone through this whole process with this other approach, and just because they'd been told to do it and they were kind of felt they needed to, they did this big flip. So then people weren't fully invested in it at that point, because they kind of they'd lost their motivation and commitment to the process, because it had changed so quickly, and they hadn't had their own say and agency within that decision. Where programs were involved with emotionally friendly settings to achieve accreditation or to be acknowledged for what they were doing, schools were then less willing to make further changes, because to them, well, we didn't sign up to make changes, we signed up because we have already got good practice and we don't need to make further changes. So then when they were told that they needed to make changes to meet the criteria, or perhaps they hadn't, a behavior policy needed looking at, there was a bit of resistance there, because it was kind of seen as, well, we've kind of already been through this process, the process is finished. On the other hand, schools that were much more ready for change reported the bigger impact. So schools reporting the biggest impact described a journey of continual growth and improvement. So constantly getting better and not standing still with it is one thing they described. One thing that was talked about was how readiness for change was also affected by a wider culture within education. So some participants talked about there being a blame or culture of fear. So some schools were almost reluctant to say, this is an area we're working on, for fear that they'd be told, well, you're obviously not good enough in this area, or, you know, it be seen as a failure within the local authority, for example. So there was definitely something around having sort of a growth and fixed mindset, having a, is this something that's kind of fixed and finished with and done, that we're fantastic at and we don't need to improve any further? Or is this something that we're going to constantly improve and constantly working to develop? And actually, where schools thought that had the latter view, the program worked better. Engagement was a key factor as well. So where changes had been made in many areas of school life, so that wheel that I showed at the start, programs were more effective where they were targeting several areas of that wheel and not just one. So it wasn't enough to say, right, well, we're going to do loads of staff training on wellbeing because everyone in the school is going to have that training, so therefore it's whole school. That was one component of it and is fantastic. But then they also needed to consider, okay, well, how are we assessing mental health? How are we working with parents and carers? It worked best when we looked at lots of different things. Where impact scores were lower, changes were quite superficial and made just to meet the accreditation criteria and less about having a long lasting change. So the depth and breadth of implementation was important. How many different places had change been implemented, how many changes had been affected, and how superficial or how deep had those changes gone. And again, talking about a shared vision, staff worked best when working towards the same goal. They were more engaged with the programme and supported changes. So one school described how there was a consensus for everyone in school why it was important we did it. Support was vital. Where schools had a bigger impact, there'd been a support of a team. So I mentioned this before, maybe an implementation team. And what seemed to happen was where people got a bit fed up with it, where people were running out of time, it acted as a bit of a protective factor, having a team, because they could provide practical support. They could say, oh, I'll do that, don't worry about that, or I'll help you with that. And also moral support, and let's keep going, come on, this is worth it, reminding each other why they were doing it, having a shared responsibility. Also linking with other schools completing similar work. I think in the past, in the distant past, hopefully, schools perhaps were more competitive and you know, there was a reluctance to work together. But I certainly think in recent years that has changed so much, and schools are so eager to work together and work as teams and work in a collaborative way. And that was seen as a hugely positive thing within this. So linking with other schools who were kind of on the same journey. Seeking support from the programme and this being easily available. So with this particular programme, a barrier was where the schools couldn't get support when they needed it. So if you were implementing a programme like this, thinking about, okay, if we need support, who can we ask? Or if you were developing a programme like this to roll out to schools, thinking, how are we going to provide ongoing support? It's not enough to simply sort of send out a package and sort of off you go. And thinking about how that support is perceived. So this particular program started off very, very collaboratively at the start and as a team. And then as time went on and there was an accreditation aspect to it, which I'll speak about in just a moment, they talked about it being a bit like Dragon's Den. And that's not what you want, because it's not supportive, it's not collaborative, and people aren't, it adds to that culture of fear and expectation and judgment. So yeah, thinking about what that support looked like. And finally, the program characteristics, the characteristics of what you're actually implementing. So firstly, it needed to be compatible with the school's existing ethos and practice. It can't be an add-on. So they talked about, oh, we've got this military style discipline in our school, but we're going to add on this whole school of mental health approach. It's got to reflect what you're doing. For this particular programme, having an accreditation process was motivating for some schools, but often led to it being tokenistic and superficial, a little change just to meet that criteria. And some people found it, you know, a frustrating process. So one staff member talked about, you're trying to put an ethos in a Word document, and it's very difficult to do that. And I think that has links to evaluation as well, how it can be very difficult to evaluate some of these changes because they can't be summarised in a questionnaire or a Word document. So just a few some final things. Thinking about who is deciding to implement the programme, why is it being implemented, and how do the head teacher and leadership staff feel about it? How do the staff as a whole feel about it? All staff. Is there a shared vision? Is everyone involved in that? One of the schools I worked with, their implementation team had such a wide variety of staff, include lunchtime supervisors, TAs, teachers, members of leadership, governors, so right across the board to ensure that everyone's views were represented. Is it compatible with the existing ethos of the school? And one thing to consider is, if these approaches work best when they align with the school's existing ethos, how are we going to develop the mental health and wellbeing practice of schools where it's not the existing ethos? So maybe the schools that need this the most, how are we going to develop the practice in those schools? Because the research suggests that actually it's really hard to implement these programs. And for those that are kind of forcing these programs on to schools, well, this is I hate to say the word like failing school, or this is a school that's really struggling, you have to implement this program. It's not going to be as simple as just sort of putting it on that school, because it's not going to be compatible with existing practice. So there are going to be links. One of the things that further research might look at is linking it to the cycle of change, things like self-determination theory. What motivates us to change, and how do we perceive change? Some schools might be at a point where they don't feel the need for change, and how can we kind of use strategies and approaches to meet a school where they are and help them develop from where they are. And also school staff just needing to be aware that implementation factors make a difference. If a programme is poorly implemented, it won't work. So yeah, just a couple of limitations about that, because I feel like, as a disclaimer, it was only a small sample of schools. They were self-selecting. No schools that I spoke to reported a negative impact, so I couldn't include them because no schools did that, but there might be schools out there that feel that it's had a negative impact. Interviews were carried out with only one member of staff within each school, and that was just because of COVID-19. We were hoping to do group interviews with quite a number of people, but it wasn't possible at that time. And factors explored were limited to those raised by staff. So there might be other factors that weren't raised by these staff. So yeah, a little bit of a whistle-stop tour. Sorry about that. I will try and just look through the chat now, because I can see it blinking, but I was too scared to look at it and try and read at the same time. That's my email address. I think it might be slightly different to the email address that is on some of the other document. I've just included that one because I'm not sure how long my university email will last. I finish in July, so if someone came to this sort of in September or something and wanted information, that would be the best email address to contact me on. Yeah, and like I said, I posted the 5 Ways to Wellbeing plan on Twitter. My Twitter handle is @Alice Tittle, Tittle. I got married, so that's why it's a different one. If you wanted to look at that, but I will make sure that it's added into the slides before they're circulated. So yeah, if anyone's got any questions or any points or thoughts, I'd be really interested to hear those. Those are just the references.
Alice, thank you so much. That was absolutely fascinating, and I've got loads of questions. But because we're very short of time, and I'm really glad that we are short of time, because you packed so much into that presentation, and it was just so interesting and thought-provoking. I'll open up to you guys, to the floor. Anybody got any questions? I know we have had a flurry of questions and comments in the chat, but if you do want to raise your little blue Zoom hand or just unmute to ask a question to Alice, please do so. Just give you a moment. One of the questions we had in the chat, Alice, was regarding the Ofsted framework. I'm just scrolling through myself, sorry. And if there is good reference to people's emotional well-being and mental health within that.
Yeah, so I think it's become a bigger focus recently. There is it's better than it was, is what I would say. I would suggest that there are other sources of for people's emotional health and well-being and mental health, sort of the Anna Freud Centre and things like that, that I would really rate. The AFSA framework is better than it was, is what I'd say. There are, and they do talk about whole school approaches as well. The Public Health England document that a lot of this is based on, I rate. I think it's good, and it has some helpful ideas and practical ideas of how things can be in school, which again I've tried to summarize here, but that there'll be more. I just want to say I totally agree that well-being, mental health and resilience needs to be in teacher training. Absolutely. One of the things I'm trying to persuade my local authority to do is to kind of team up with some of the initial teacher training places for maybe educational psychologists to provide some training, because I'm just conscious that I had nothing when I trained to be a teacher on this. Maybe half a day on social, emotional, mental health needs, and it's just not enough. It's so integral to what we do. So I totally agree with that.
Yeah, no, oh,
sorry, Gia. Sorry. Yeah. Oh, is somebody else talking, or?
No, you go ahead.
If I jump in. Oh, okay. Sorry, I've just trained so I'm a teacher, and I've got a psychology degree, but I've just trained as a CBT psychotherapist. And so this is like very, very, very relevant to me. And I've just started this intervention in my school. I live in Sheffield. And so I offer, at the moment, currently one-to-one to obviously, to groups of children that get referred from the head of years. And the intervention is about 6 weeks. And of course, my school is fantastic and is implementing a whole school approach. And I think it's starting to slowly develop. And it was really interesting to see and to hear your point about how do you measure that sort of impact. So I'm wondering how much you have maybe noticed in your research how other services such as maybe PWP, educational PWP, get used in school at the moment currently. Because my feeling is, I mean, obviously I'm incredibly pleased and happy to have this new role in my school, but I feel like I'm being kept in one little sort of area, but still not used 100%. And I feel like my knowledge, or could be perhaps it's me not able to sell myself properly, or somehow. But I was wondering if you had any tips or any ideas or any experience of that as well.
Yeah, absolutely. I think I think that one of the things we do know is that children talk about where and I think there's a really interesting I don't know whether you've come across it. The NHS has done a survey of mental health in children and young people, and it's just been updated 2020, and it talks about seeking support. And I think that one of the things that is highlighted at the school is the primary area that many children seek support. I think you're absolutely right that at the moment, a lot of the time, the role of sort of a mental health practitioner in a school, the impact that had, I think that although it's something that's been going on for schools in many years, it's almost only developing to a higher level more recently. And maybe part of that's down to COVID. I think it was sort of several things coming together at once. People seeing the need for it. I don't think it's evaluated enough. I think that there aren't enough, things down on paper, and maybe, thinking of a small scale, how can I show the impact? And that might be, I'm reluctant to go down the path of everyone should do a questionnaire pre and post, because I think one of the things that my research found was, again, is that's on children rather than with children. So I think, within your role, it would be really interesting to see sort of practice-based evidence. What evidence can you find from within those children that kind of shows how, because we know how powerful it is, but sometimes it's like having those things down on paper.
And this is what exactly what I found. The intervention that I've designed 6 weeks is having quite a big impact, and I think in a way I'm also fairly surprised by it. But it would be interesting to see how I feel like school is so a bit, maybe they don't trust, but also they don't know a lot about it. So definitely evaluating the impact, that sounds a very good idea. Thank you. Sorry,
no
stealing you away.
No, I think that sounds really interesting. It sounds like amazing work. It sounds like a fantastic intervention as well. So, and like I said, I would be saying to your school, if they're implementing a whole school approach, they need to be evaluating all the parts of that, and your work is one part of that.
Yeah. Well, exactly. I was literally just thinking about kind of jumping in that, because I'm doing a master and the dissertation will be on my intervention. Okay. So that was what. So I'm kind of stealing. I was very, 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 very interested about your paper and your presentation, thinking maybe I could use. Thank you.
Yeah, no problem at all.
Oh, thank you, Julia. We're into the last 2 minutes. Is there anyone else who would like to ask a question or comment just before we wrap up? Just going to go back to the chat and have a little look.
I'm trying to just scan.
I think what really struck me, Alice, was this notion of embeddedness. And of course, it's called a whole school approach. So of course, it should be holistic. But the way you kind of went through how it should be integral to every aspect of school, completely, in opposition to anything sort of interventionist or tokenistic. And that it even comes down to, being threaded through the ethos and the values of the senior leaders, the parents, the young people, the entire community and the way it works. I mean, that was, I just found that fascinating, really interesting. And, I can see why it is a difficult, it is problematic to evaluate. I can see why it is, and why it's difficult to implement as well, I think.
Very difficult. And I think sometimes the whole school programs are kind of, we've got a whole school approach. It's seen as a bit of a solve all problem, and well, just do a whole school approach. But they're huge and they're massive, and they take huge amount of focus to be done properly. And what worries me, I think my final comment would be, these can work. They do work. I would worry that something might get dismissed. These sorts of approaches might get dismissed as not being effective when actually they've just not been implemented effectively.
And I think on that note, we'll leave it there. I'd like to thank on the promise of possibility, and I'd like to thank Alice, but I'd also like to thank all of you and apologise to those of you that came in late because of an incorrect link that I sent out. So I'm very, very sorry about that. I will send out videos, slides, templates, papers, everything.
I'll make sure you have the template. Yeah, I'm sorry that wasn't included. That wasn't helpful. I obviously intended to go back and add it in and just did not. I'm glad it was helpful anyway.
I will definitely send those all out tomorrow, or in the coming days at least. So yeah, thank you everyone. Enjoy the rest of your evening and take care.
Thank you.